guys, April Lopez coming to you live from Lopez Family and Wound Healing Center. So today I want to continue with our topic regarding wound care and how we can help wounds heal. As you guys know, I am a board certified wound care specialist. I'm also a certified skin and wound care specialist, so we treat a lot of skin conditions. And also I am board certified in family practice, an adult geriatric acute care nurse practitioner. So I've been in healthcare for over 24 years. I've been doing wound care for over 24 years. I remember doing wound vacs, sitting down in patients' homes with no air con. All of my nurses out there that do home health can attest to the fact that it's very difficult to apply a wound vac, but it's a little bit harder when you have the dynamics of, I'm sorry, we're so busy in the office, of no light, no air con, and having poor patients have rectal wounds or perirectal wounds where we have to apply a wound vacuum in a very difficult area, and you literally have to sit on the floor to do it. So we've dealt with very, very challenging wounds. Those of you that we've helped heal know that we are pro preventing amputations. We never say yes to an amputation unless you've given us a few weeks or a few months to help you heal. We specialize in very old wounds that have been there forever. Patients do heal. Every time you look at a wound, you have to look at it with a fresh set of eyes. And I think one thing that really differentiates us from other people is sí se puede. Yes, we can. And Effie, I love you, sister. I have a patient of mine that just passed, and he was like a dad to me, and Effie's like a sister to me. And we worked on all these different wounds for him, and he healed every single time. And this last time with his last one, right before he passed, I remember that she texted me and she said, you know, Dad said, just send me to April and she can fix me. So I just want to say that the first thing that you have to do to be able to heal a wound, we talked about prevention in the last video. To be able to heal a wound, you have to have a provider that, one, cares, two, knows what they're doing, and three, has a yes, we can attitude. We cannot just tell a patient, oh, you've had it for so long, you know, amputate it. That is the last resort. I have very good doctors that do peripheral vascular disease interventions. We have a large group of doctors throughout the valley that can help us open arteries, take care of vein issues, because remember, which is a topic that I'm going to talk about today, plumbing. If you don't have good plumbing, you're not going to get any blood flow to an area to be able to heal. Example, you have all those patients with a stage 4 pressure ulcers. Why is it a stage 4? What's a stage 4 pressure ulcer? It's an ulcer that's all the way to the bone. Usually we get those in the coccyx and the lower butt area. And the key to that is prevention. Like I said last video, turn the patient, offload the patient at all times, keep them off that area, okay? Because a small amount of time with pressure over an area with not a lot of fat can open up that wound, right? Well, once it's open, how do you do it? Plumbing. In an area like that, our goal is to offload the area, okay? Prevent the pressure on that plumbing so that you don't get further breakdown. If you don't do that, the patient's not going to heal. Something else. Let's use wound vacs. There's so many different companies. They're these sponges that we put in wounds, and we do them for a few reasons. Guys, I know a lot of you think that all wound care is to heal a wound. There's also some wound care that is palliative wound care, so patients don't die from other conditions in addition to having huge ulcers all over their bodies, and that's humane. If you have a patient that has a huge ulcer that is end stage, or like has a huge ulcer and also has cancer, we've treated patients like that before. If a patient has a huge tumor, say for example on the face, and they're so weak that they've been in bed, they're gonna get an ulcer maybe in their elbow, in any bony prominence, maybe in the coccyx. We can apply a non-pressure dressing, pressure dressing to that area, like a sponge, okay? That's gonna help remove liquid and prevent infection to that area. Especially if you have a patient with a lot of diarrhea, you can apply a wound vacuum to protect the area. It's a sealed area where the feces is not going to get into a wound, and that's going to prevent an infection. So yes, we can. You have to have a yes, we can attitude. Okay, we're going to do one in Spanish. And so plumbing, that area, remove pressure from areas, okay? That area has really good plumbing. There's a lot of vasculature to that area. There's a lot of blood flow to that area. Feet, legs, if you don't have good blood flow, you're never going to heal that wound. So the first thing we have to look at your plumbing. We have a machine called an ABI. It's going to help us see how your circulation is, okay? And we can start with that test and see if you have good circulation. And if you don't, we can send you to a place that they can do a revascularization. They can do tests, further tests to see how your plumbing is. Remember plumbing, arteries and veins, right? If there's an issue, we address it. But in the meantime, we have to have good aggressive wound care coupled with good family, a teamwork attitude, family involvement, patient involvement, to where we can get the patient good wound care until we can get you to that place where they could fix your plumbing. So that's the next video in our series on how to heal wounds. I hope it's helpful. If you guys have questions on how to check the plumbing, how to check the circulation, how to check if your wound is on its way, it's very simple. Every week you should see improvement. If you're not seeing improvement, you need to seek a second opinion. And if you guys have any questions, inbox, or you guys can send us a private message. Nurses, I get them all the time. Send me your messages, no problem. And I'll see you soon. Bye, guys.